Welcome to Integrated Healthcare. I'm taking you on a really quick tour of the practice. You can learn about what we do here and how we help people. For 25 plus years, we've been here helping people lead happier and healthier lives. Who are we, and what do we do? Well, Integrated Healthcare is a primary care holistic practice. You need no referral to come. We take people with all different types of problems, barring a bloody emergency or a heart attack or something that would kill someone. Regardless of what you have, it can probably be helped and enhanced with drug-free healthcare. Sometimes to the exclusion of drugs, and other times you have to use them at the same time. So how could we possibly do this? Well, first, let me tell you a little bit about myself, then I'll show you some of the things we do. Integrated Healthcare is a primary care holistic practice that uses the tradition of different time-tested alternative therapies. We combine those therapies into one program that's custom designed for each patient, and then we complete it. And at the end of the program, most patients, we'd say well over 95%, experience some kind of improvement, and for some, it's life-changing. I went to chiropractic college and graduated, and at that point started my first practice here in Montclair, New Jersey. I then went back and studied further to get a board certification in this holistic technique, and the name of it is Applied Kinesiology. Applied Kinesiology, you can look up, is one of the first organized forms of alternative healthcare. It was being done when it really wasn't cool to do this kind of work. And as a result of this methodology, we tap into and are trained in the use of traditional acupuncture methods. We are trained in the use of several different types of hands-on techniques, which you have to see to fully understand. And we are trained and expert at manipulating every joint, structure, bone, muscle, and organ in the human body. It is this therapy coupled with nutrition therapy in the form of herbs, vitamins, minerals, and it is this therapy coupled with management of lifestyle that makes our holistic experience unlike any other. Do you ever go into the grocery store and wonder, man, how do I know which of these things I could possibly take? It's hard. But what if there was a way that you could find out exactly what was needed based on your individual's body responses? Well, guess what? We can do that here. We check for a variety of nutrients, vitamins, minerals, even the glands of animals for those that eat and that are not vegetarians. And we can check the energy and heavy metals and how those heavy metals impact the body. Just in case you didn't know, the environment's a bit toxic. So we have to deal with the burdens created by those heavy metals, and they oftentimes cause health problems in people. So we check for that here. So there you have it. You got a snapshot of some of the therapies that we offer in the way of nutrition, herbs, vitamins, and minerals, custom designed for each person. Who does that? Then you got a snapshot and learn that we certainly do weight loss and help people balance their bodies naturally. And we talk then about some vitamins, custom-made herbal tinctures, flower essences, sensitivity and allergy type testing, and all these tools are used in this treatment room along with these hands to stimulate the healing process and correct abnormal structure so that people suffering from any malady can feel better. In this room, we do live blood cell analysis. Live blood cell analysis, you might think. It's a lot different than blood cell analysis where you go in and the blood is drawn from the tube and then the tube is set on the counter and the cells die. Yes, it's useful, obviously, for certain types of diseases and illnesses, but live blood cell analysis is the other school of analysis where we take a sample with a lancet and we put it onto a slide and then we look at it instantly, and on our screen here, both the patient and the doctor can look and observe and see structural imbalances and problems that exist in the blood. It's a morphological or structural study of the blood, and we have found out that diet lifestyle, and food and toxins can change the structure and the behavior and the dynamics, the fluid dynamics of blood. So if we take a really good history, do a proper examination, and then marry that to live blood cell analysis, we have yet another way that we can help people reach a new level of health and wellness. So there you have it, a really quick tour of Integrated Healthcare of Montclair. But as I said when we first started, this is all just seeing things. It's not experiencing the practical power of this particular healing method. Looking without doing leaves a lot to be desired. Come in, sit down with us, talk to us about your health challenges or your health goals, and we'll see if there's a way that we can help you achieve them.